So we'll dive in. We'll see how mobile devices and HIPAA can get along together. That's really what we're going to be looking at, is to see how do we make it so we can actually use these technologies that we're so used to using these days, and so have become so much of a part of our lives right now. How can we use these technologies and allow HIPAA to get along with these technologies? How we can avoid being in violation of the rules? We'll see what kind of risks there are to privacy and security of information, because that's really where the problems may be, is making sure you handle the privacy issues appropriately and don't have any security problems, and make sure you protect the information that's being transmitted or received or maintained on these devices. So there's lots of issues with mobile devices. We'll see what kind of guidance there is from our friends in the National Institute of Standards and Technology. Our friends at NIST, they have some guidance that they finalized in the past couple of months that's about using mobile devices in conjunction with electronic health record systems. So we'll see what they have come up with there. There's some interesting conclusions they've reached there. We'll look at how you can handle patient communications and how email and texting can work under HIPAA, and how there are certain circumstances, very limited circumstances, when you can be using unencrypted communications for health information, but it has to be at the patient's request for their own communications. That's really what it's limited to, but we'll talk about how that's possible. And we'll see what kind of HHS guidance there is on patient communications and access. There's plenty of it out there, and we'll take a look at some of it along the way to point out some of the important answers that are out there, and where you might look for further answers if you don't see the answers you're looking for today, because there's certainly more questions than we can possibly cover in the space of one webinar when it comes to issues of mobile devices and healthcare and patient access of information, all these kinds of things. And of course, as we go along, we'll be talking about lots of things having to do with the regulations. Some of these things may have an impact on your own policies and procedures. You may need to keep your eyes out for things that you may want to update in your own policies, so that you can be more in compliance with the way the modern world works and with modern interpretations of things. It really matter of this. A lot of the matter of what we're talking about here is making sure that you go through the process of being prepared for something like an enforcement inquiry or some kind of an audit request, where you're asked to show your compliance, and that means having the proper documentation of having the right policies and procedures and having actually used them when you're supposed to. And so that's the idea, is to have that kind of documentation in place, and we'll see what's involved with that, and how you can have some kind of idea as to what's a reasonable documentation to have along the way. And we'll have some time at the end for some questions and answers, so I'll be more than happy to take any of your questions. That's always my pleasure to deal with the questions that people have, because that's what really brings it to life, is the particular situations that we all have to deal with on a regular basis. My own background is I'm an engineer. I'm not a lawyer. This is not legal advice. I'm just providing some information based on my background of dealing with this HIPAA stuff for quite some time now, going on 19 years of focusing on HIPAA, and it is a kind of an extensive focus I've had all these years, such that I've collected a lot of resources, a lot of stuff that I want to be able to get back to again later. A lot of various links to stories and news and things like that that really are something I want to be able to come back and find again later for some reason. Well, I posted all that on my website so I can find it later, and you can find it as well. So there's all kinds of pages full of resources and things like that. I'm afraid I'm a little bit behind schedule. I have a couple of announcements from the Office for Civil Rights I need to get posted out there, and also update perhaps my resource pages to provide a little bit more flexibility there. It's going to get kind of full the way they are. It's not easy to keep up with all this stuff, but anyway, so yeah, I do try and provide some important stuff for you there, though. So if it is stuff of value to me, like I say, it's out there on the website, so take advantage of it. It's free of charge. You don't have to register. You don't have to give me your email address or anything funny like that. It's just a bunch of links to various resources and tools and guidance and things like that. So take advantage of it. So what we're talking about today is the HIPAA privacy, security, and breach rules and how they fit into this world of mobile devices and healthcare. And what we're talking about is the privacy rule is one aspect of it. That's really sort of the core of everything we're talking about. Is you're talking about the privacy rule, which establishes the rights of individuals. It says what the rights are that individuals have, one of which is to choose their method of communication, and also about the controls on the uses and disclosures for the organizations who have that information. So those controls being, as you move information around, you need to make sure it's properly protected, properly secured. And that really is the kind of thing that winds up being in place as the rule for professional communications, although individuals do have rights under the individual rights sections of the privacy rule, again, to choose how they communicate, including choosing to use something insecure like plain email or plain texting. if you're prepared to handle that. Okay, so there's some aspects of how you're allowed to use or disclose the information that would limit your using those kinds of insecure technologies, but there are individual rights that can be exerted that allow people to ask for those communication technologies to be used in their own communications processes. They can't do anything. Your patients can't say, "Oh, I don't care what you do with your communications with everybody else. Communicate however you will." They can't really free you of your HIPAA obligations that you may have otherwise, but they can certainly exert their rights to communicate in the way that they see fit about their own communications. That's where it comes in. So that's what the privacy rule is all about, is this delicate balance between individuals and the organizations. I mean, you can see we're just talking about the simple process of communications here. It's not straightforward at all. I mean, we're just looking at one little aspect of the privacy rule here, looking at individual communications. And when you start looking at the individual rights and the requirements to protect information that you have for controls on usage and disclosures, these things, you can see you wind up with some pretty tricky sort of things to sort out. You might say either sort of conflicts or battles between various rights and limitations and things like that. How do you make all this stuff happen? Well, that's really the art of the privacy rule, is understanding how to come to that balance. And access of health information, this is a big issue for Health and Human Services. If you haven't been paying attention, all this noise about data blocking and the people having their systems set up such that it's difficult to share information between one system and another, this is all tied in with the same issue of access of health information. The folks in Health and Human Services see this as a national priority to improve the nation's health, to make it easier for people to have access to their information and be able to have that information shared with other providers as they see fit. It's a big thing. That can actually make a big difference to how people's care is being delivered and how people can feel better faster, those kinds of things, right? I mean, these are all valuable things that help reduce the cost of health care. People can be better taken care of, okay? So the idea is to be able to have better access to information, better sharing of information. This is an area where you want to make sure you're doing things appropriately. Otherwise, you're going to be going to be out there with a target on your back as far as HHS is concerned. Security rule is all about the electronic information, gives you the things you need to think about when you're thinking about, information that's held on some kind of electronic device or being transmitted electronically. And, well, lo and behold, what are we talking about today? We're talking about all these mobile devices. Well, this is sort of the core of the security rule. We're talking about, what kind of example of issues might you have? We're talking about electronic information that needs to be protected while it's being transmitted, and also while it's being resident on these devices. And it may be on devices that are moving around. You don't necessarily have the same kind of control over a mobile device as you do over a workstation that's bolted to a desk in your office. Okay, well, mobile devices can be wandering around from all over the place. How do you know who's who and who's got that device and who's doing what with it? And how do you protect your information when you have these mobile devices involved and we're dealing with electronic information? So the idea is to look at how you use your information and what kind of things you use to play with your information, such as the various systems you use and your mobile devices and things like that. And you use some risk analysis to figure out what are the issues I've got based on how I use information, based on what might go wrong, and what things might I have to respond to. Okay, well, the risk analysis helps you understand how you're going to deal with it if something goes wrong, and how bad is that going to be? What do we have to fix before we go any farther? Okay, that's what the security rule is all about. Breach notification is when things go wrong. If you have a violation of the privacy rule that results in some kind of an acquisition, access, use, or disclosure of PHI in violation of the privacy rule, that becomes something that can very well be a reportable breach. Okay, so it's good to have good precautions in place to avoid those problems, either from a process standpoint or also from a technology standpoint, taking advantage of the security rule and realizing where you may have some risk issues and putting the proper safeguards in place to protect the information. Okay, so breach notification has been enforceable since 2010. If you have something that's reportable, it has to be reported to the individuals who are affected and to Health and Human Services. Of course, it can be very expensive to deal with, it can be very painful, it can be very embarrassing for your organization, but it does provide some great examples of what not to do. On the HHS website, where they post all the large breaches that we all call the Wall of Shame, even though they don't. They're not that rude, but those of us in compliance can be that rude, I suppose. Anyway, they post all the breaches that affect 500 or more individuals, and those are important things to see, because you can see, well, what are all the big problems that are happening out there? What kind of issues are people having? What kind of things are going wrong? And you'll see that obviously these days the number of breaches and large incidents caused by the hackers and people who are giving ransomware demands and things like that and causing all kinds of havoc out there. There's obviously some huge impacts there, but there's an underlying issue that's been running along ever since the beginning of time as far as HIPAA breaches are concerned. There's that issue of laptops and portable electronic devices that have been lost, stolen, or improperly disposed of that have health information on them and haven't been properly encrypted. Because if you have these things properly secured under the breach notification rules, then they're not reportable as breaches. And so the important thing that we can learn very easily from the wall of shame is that if you have portable devices, the first thing you better do is make sure they're properly set up. Because otherwise you're leaving yourself open for one of the breaches that happens all the time that HHS is bloody well sick and tired of. Okay, they don't want any more of these silly breaches having to do with people having portable devices that aren't properly secured. It's just ridiculous that they're not, because it is so easy to do, and the stuff that's built in is so ironclad these days. Why isn't it done? It's because people are too lazy to, it seems. It's a matter of will. It's not a matter of cost or anything like that when it comes to these portable devices, when it comes to these mobile devices. It's usually a trivial thing to make sure they are properly secured. So you better make sure you do so, because if you do, you can avoid all kinds of breach issues. That's what you got to watch out for, right? So you don't want to go down that path. So we're talking about HIPAA compliance in mobile devices. Okay, so we have these mobile devices out there. They're already being used. All right, just look around. People who don't have these things in their hands are probably asleep or actually getting some useful work done the way they should. Actually interacting with the patients, people you're taking care of. But anyway, these things are out there. The idea is you want to be able to stay out in front of these things. You want to be able to stay in front of the curve. This wave of stuff is coming at you. There can be more and more ways that people find to use these things all the time. I mean, it's so obvious how to take advantage of so many of these technologies that are built into these devices without getting fancy or getting any new apps or anything. Just for basic communications processes and business processes and things like that, it's really possible to refine and revise how you do business if you have better communications, and that's what all these mobile devices enable. But there's all kinds of issues that you may have with how you protect the information. Okay, because you may have some issues with how the information is transmitted or stored. You may have some issues about how you're actually going to be using these things. What is your strategy? How are you using these things in your office? What's the point? You have control over these things, or are they just being used willy-nilly as people have decided to, and you're not really sure what they're being used for? You don't want to be in that situation again, right? So when you're talking about dealing with your staff, it's one thing, and then you have to think about dealing with your patients, with your consumers, okay, who have certain rights to communicate the way that they see fit, but you have obligations to make sure they're being properly taken care of, okay? And you have proper documentation of conversations with them and things like that, so you can show what kind of things have happened in the past. You can, have some background of any particular situation. You need the history, right? Okay, we have to have some way of documenting that and processing the information, making sure it's all handled properly. I mean, it requires having a good patient communications policy and how you're going to handle these things. Okay, it's not anything obvious really. You have to make sure you work your way through and think your way through the various situations of how you're going to use these devices, either in your office for business purposes or also in your office for communications with the outside world, and make sure you're doing things only the right way. So there's lots of ways of using mobile devices. There's certainly personal uses, all those things we have, listening to our music while we're riding on the way to work on the bus or whatever, as well as our own personal schedules and calendars and things like that, and all these kind of regular stuff, taking pictures, Facebook, all these kinds of things I don't really ever use, but that's fine by me. Anyway, so we have some regular business uses, though. There's some ways you can use these kind of mobile devices in your businesses that people are probably using already. Things such as, hey, will you put on the grocery list for us that we need more toner for the back printer in the back hall, okay? Or our Office Max grocery list or whatever, our Staples grocery list. Would you put on our list for we need more paper for the printer up front too, okay? These are all things that it's just sort of standard business discussions. And hey, I'm having a problem with this printer back in the back hall here. Can you call IT and have them come take a look at it, that sort of thing. These are sort of normal communications. There's no health information involved, all right? Now, that's a fine way to use a mobile device, I think, right? But you have to be careful because you're also using some communications that do involve protected health information. And so are you using portable devices for any of these communications involving PHI with mobile devices in your office, okay? So if you're dealing with, office information or professional communications, these are the kinds of situations where you're having some PHI involved. You need to find out how are your devices being used already, okay? Because you may discover that if you don't ask around, you may discover that you think they're only being used for situations where there's no health information. But somebody else may have decided, oh, well, I can start using these for communications with PHI. They should be okay. I think they're safe. Well, they may not know what they're talking about, okay? So you need to find out, what information is it and how identifiable is it? Are they just using sort of, saying things like, the person in the back room is ready for their appointment? Or are they saying Mrs. Smith is ready for her appointment to deal with her particular kind of skin cancer or something? There's a difference in what these messages are and what the content is, all right, and how understandable they are as far as being identifiable. Okay, so there's certain kinds of health-related communications you can have that where the information isn't necessarily identifiable, but it's the problem is you're getting on the edge, and it's getting hard to tell as you work your way down this list here. When you get to the world of professional communications, like between doctors' offices and between doctors discussing particular cases or looking at particular details, or having a background discussion on a particular patient or something like that, this stuff. If you got identifiable PHI involved, this stuff needs to be properly secured, okay? Because you can't just have this stuff out there wandering around on the internet. And then there's a whole separate category for looking at the communications with patients themselves, okay? And so, are you actually using these devices for these communications? Is health information involved? And did the individual request this mode of communications? I mean, here's the thing: is patients, according to the guidance from HHS, patients are allowed to say, "Listen, I would like to communicate using plain email or plain texting. I cannot stand to use your lousy secure website." And believe me, I'm one of those cranky consumers who feels that way. I'm one of those guys who doesn't want to use the patient portal because if I have to learn one more ID and password, I'm just going to scream. I'm sick to death of IDs and passwords, and aren't we all, okay? Can we just have an email conversation? I don't really care about my information. But that's just me, okay? So you can't make any generalizations about what some other patient might prefer or not. I wouldn't mind necessarily having any of my health information discussed in the public, okay? But there are other people who would be very, very cautious about having any of their information discussed in public, depending on who they are and their position and things like that. So, so when it comes to communicating with the patients, they have rights to communicate the way they wish. You want to make sure that they do make that request themselves to use something insecure. They can't have this forced upon them. They have to make this decision themselves. So you really need to have a mobile device policy now, okay? Because even if you don't use texting now, you're going to. Even if you don't use your mobile devices with email now, you're going to, okay? That's just the way it's going to happen. These devices are too convenient not to use these tools with the normal means of communication. So you want to define how your mobile devices may or may not be used for various business or patient communication purposes, and talk about the various requirements you may have for using secure processes when you're involving protected health information, either by using manual settings, that you enforce with sort of manual policies where you say, this is what we're going to do, make sure you do this, okay, which can work, or by using mobile device management tools that require the appropriate policies on the devices, or else you won't be able to access any of the information. So there's a couple of ways to do that. Again, I'm a big fan of using policies and procedures to accomplish goals, and having manual settings that you check by policies. That seems so much nicer than being able to force all the machines to follow the right settings using mobile device management tools. But you do have to check and make sure these things are actually being done. You have to make sure the settings are actually correct and haven't been changed. So it requires more manpower. Okay, it's not so automatic. It's a little less intrusive, perhaps, a little bit nicer, perhaps, but it's not necessarily as effective. So it depends on what your situation is, which one's going to be the best way for you to deal with things. But you're going to have to define what your process is, whether it's via manual settings on the policies or by using mobile device management tools to force those settings. And you also have to define in your policy how you're going to handle the patient rights for requests, rights for access preferences. The patient requests to be able to communicate the way that they see fit, and not necessarily what your preference is. And so you have to be prepared to answer those questions at least, okay? So your professional communications with PHI must be protected, okay? If you do a HIPAA risk analysis that you need to do for electronic information, it's required in the security rule. You'll see, well, we got some risks of using insecure communications, such as plain email and plain texting. Things can go wrong. Stuff can get exposed, okay? And organizations that discover they've been using insecure communications can sometimes report those communications as a breach, particularly when you see something where somebody's been using one of the email services, one of the consumer-based email services for communicating protected health information. And it's one of these services that has been very public about saying how they read all your email and look over all your email to make sure that they know how best to market things to you. And most certainly they look for medical information and things like that. Well, that sort of constitutes a breach there, I would say. If you have health information involved, it's supposed to be protected in some way. That's not protecting at all. So when you see these kinds of insecure communications having taken place, you'll quite often see these things reported as a breach. And some of the enforcement settlements are based in part on the use of insecure email or other professional communications that are not properly secured. So you want to make sure you watch out for that. And as well, the folks from the Center for Medicare and Medicaid Services, at CMS that is, and the head of the HHS Office for Civil Rights also say, no, you got to make sure professional communications are properly protected. You can't just have this stuff going out in the wild over the internet without making sure it's properly protected if it is identifiable health information. So it's it seems like some fairly simple rules. Okay, for professional communications involving PHI, you better make sure it's properly encrypted. So when it comes to your mobile devices, okay, you have to really define what your strategy is going to be. Okay, you have to decide, well, how are we going to deal with these things? Okay, what are we doing with these things? Okay, you have to decide how are we going to use them, or are we not going to use them, or are we going to try to ignore them? And well, I don't recommend you try the ignore option because that's not going to work. Okay, so you have to define what your non-PHI uses may be. Some of the ones like ordering more toner for the back hall, the PHI uses, and maybe some particular client or patient communications uses as well. There's different kinds of levels of communication and different kinds of information. How are you going to handle this for different kinds of communication? Are you going to have different kinds of rules? How are you going to sort this out? And are these rules going to apply to people's own personal devices? Are you going to allow these things to be used? People's own devices, BYOD, bring your own device. Are you going to allow that for people to be able to use their own devices to be handling patient information? That's one of those things that makes me very, very nervous. Okay? You want to make sure you secure your devices. Okay? You want to make sure any mobile devices with any PHI on them have strong security. Make sure they have encryption turned on. Make sure you have good, strong passwords, and you have all the settings set to be able to make it so that if the device is lost or stolen, it can be automatically wiped clean or turned into a useless brick of plastic and glass, whatever it takes to render it inoperable and destroy the data. So we want to make sure you have all the right settings for all this stuff, and you want to be able to make sure you're managing these settings either by having mobile device management tools, or you can do it with just policies, like I say, but you do have to do some regular audits and verification to make sure people are actually following your policies and not circumventing your policies and going around them, because sometimes it's easier. Well, people can be very lazy sometimes. And also, if it is a BYOD situation, if it's somebody's own personal device, make sure before they trade it in, make sure that they clear any data off of it, because if they take that device in and turn it over to their local Apple store, they'll be turning it over with health information on there that they've lost control over and can't even necessarily get to delete anymore. So that could be a dangerous situation. Make sure people know. When you get that time of year when everybody sort of gets that iPhone fever in the fall, when they all start wandering off like a bunch of zombies in the nearest Apple store, make sure that they know to clear the PHI off before they trade in the old one, so they don't wind up exposing information inappropriately. It's not a good thing to do. There's some great guidance from NIST, as I mentioned before. It's their guidance on communications and mobile devices. It's their securing electronic health records on mobile devices. It was finally published in July of 2018. Came out with some great content in there, and there's came in a number of sections. And really, it's all about looking at the situation and saying, okay, well, listen, we have an electronic health record system, we have mobile devices. How do we make this stuff work together in a secure and safe way, right? Okay. So it's written in a number of sections about the summary of what's going on and what their various security characteristics and their approach was, and how to actually enable their solutions that they've come up with, including all kinds of specifics that mean nothing to me, but to somebody who understands this stuff would mean a whole lot. Also, various mapping everything to various standards and controls and things like that, and doing some of their own risk assessment and outcomes to determine what some reasonable ways to do things. And they include along the way lots of valuable information. It's really quite a lot of detail in there. If you're looking at in the approach and architecture and security characteristics, they give you a scenario saying, look, you've got somebody using a mobile device, and they want to do something that they would do on a regular basis, such as sending a referral or sending an electronic prescription to a pharmacy, or perhaps connecting to an EHR hosted by a larger entity from a smaller one. Okay, that could be somebody in the doctor's office connecting to the EHR at the hospital in some way, perhaps using a mobile device. Okay. And they say, listen, our design was demonstrated with a certain suite of products, but we don't necessarily endorse these products. There's all kinds of things that you can do to do the same kind of thing using a variety of products. And so they include plenty of disclaimers and things like that give you make sure you have the idea that just because they choose certain things to illustrate their approach here, it doesn't mean that's the only choices. There's lots of other things that get you in the same place. If you're in this kind of business, you know what some of those alternatives are, obviously. I mean, if you're dealing with the world of security and privacy and electronic information. So also what they look at and say, well, what are the security concerns? Maybe you have somebody who might lose or misplace a mobile device, okay, or maybe they get some kind of exploitation or theft and somebody steals the device. Or it could be a mobile device gets compromised in some way, or maybe there's some kind of an untrusted network that uses a man in the middle to capture login credentials and things like that, and then use that to log in later on. Or there could be some, a situation where you're having, where you interact with other systems where you may have some risks of compromising routine operations such as data synchronization and storage. So you have all these things where something can go wrong from a security standpoint. And they say, well, what are the various configurations we can look at? Where we're looking at wireless connections for mobile devices or outsourced support for system access, such as using a cloud service for systems access. Or maybe you have organizations with a completely external access point, such as a VPN access point or something like that. So there's lots of different ways that you might be able to connect into the organization. You will have access either by a wireless point or on the cloud or VPN or something like that. There's lots of options on how you accomplish this. The various things that can go wrong that they list are, okay, well, you've got a lost or stolen mobile device. Okay, something gets lost or stolen, or if you have a user who walks away from a device that's logged in or downloads viruses or other malware or uses an unsecure Wi-Fi network and perhaps exposes their credentials on this insecure network and maybe exposing the content as well. Maybe you have inadequate access control or enforcement of your access controls and inadequate change management and configuration management, so you can have some exposures. Maybe you have inadequate data retention and backup and recovery procedures to make sure you can recover from a variety of circumstances. And what their conclusion was they came to, and they worked their way through all the various options of how they might handle some things. They came with a process that works pretty well when you're talking about logging in remotely with a portable device. Okay, in which case you don't necessarily know who has the device or where they're logging in from, but here we go. Okay, so how do you do this? Well, first thing I say is, well, you're trying to log in, huh? Well, is your device on our list of OK devices? Okay, so you have a list of media access control addresses. And every device has its own unique MAC address. And that's nice, except that this is not an ironclad thing. MAC addresses can be spoofed. Like if I know that your MAC address is such and such, I can force my MAC address to look like it's yours. Okay, so this is not perfect, all right? But it's the kind of thing where if you don't wind up on the list, you're not going to get through. Okay, so you have to at least make it through getting on the list to, so it has to be, at least a real MAC address or one that's being spoofed on purpose. Okay, so that at least limits it so you have to get, there is a hurdle to get over to get through that first step, okay? The next step is it says, well, the access point looks and says, okay, well, listen, you're trying to get in. If you have this MAC address, you should have this security certificate installed on you. Let's see if you're there. Are you there certificate? Okay, and then yes, if you are there, we run a compliance check on the device. Okay, you do have your security certificate, so let's look and see, is the device configured securely the way it should be? Is everything all set up the way it should be? Has it been tampered with in any way? Okay, everything's fine? Okay, at this point they say, okay, well now at this point we're pretty sure we know that this is a real device that we think it is, that should be authenticated to be able to log in. Now we're allowing you to go ahead and use your ID and password to actually authenticate to the EMR and start accessing the information. And so as you can see here, no one of these 4 layers here is particularly thick or particularly crispy. Just each one of them together, added to the next one, becomes a rather strong security because you have to first of all be on the right list to get in, and that's not perfect. But if you are on the list, then you have to make sure you have the right certificate, and that sort of controls a lot of that problem. And then you have to check and make sure the device is really what it says and is, hasn't been tampered with, and by that time you're pretty well sure you know who you're talking to. You just do some authentication with the ID and password, you know specifically who you're talking to. And so it's a pretty nice process, and you notice it doesn't require that you have any third-party tokens or nobody has to send any codes to your cell phone or anything like that. It just uses a much more background process that works actually quite well. And so in the 1800-E, they also have a risk questionnaire for a cloud-based EHR vendor. I recommend this questionnaire. It's a really great questionnaire if you're in the business of looking for, if you're in the market looking for a new EHR system. that might be a cloud-based system, you might want to ask these questions. There are 34 questions in 8 different areas. And the nice thing is, this is a nice questionnaire to be able to modify and use for other purposes as well. You don't have to just use it for just your EHR system. Okay, you can use it for other kinds of things as well with some simple modifications. So take advantage of it. It's a nice set of questions that can help give you some more background information to help you understand whether or not your vendors really are who they say they are, and whether they know what they're talking about when it comes to your business associate relationships. Now, there's also some great documentation from healthit.gov. That's all the stuff having to do with your mobile device and health information, privacy, and security. That's really what we're talking about today. Is there's lots of information they have. They have various written and video training materials, information about how to protect and secure PHI, about your organization, various steps to take to protect mobile devices, and various other documentation as well. Let's look at a couple of things they touch on there. One thing they list is there's some information on what can you do to protect and secure health information when you're using a mobile device. Well, that is that's the basic thing we're talking about here. When you're using a mobile device, how do you protect the information? The first thing is make sure you have a good password on the device. Okay, that's an important thing, and making sure the device is actually encrypted as well, so that if you don't have the password, it's not just a matter of not being able to get into the machine. It's get into the device. It also means any information on the device is also encrypted, so that even if even to get past the password, you have to be able to get past the encryption on the device itself. You have to have the ability to do some remote wiping and disabling of the device. Make sure you can shut it off remotely and clear it from a distance if the device is lost or stolen in some way. Make sure that people don't use file sharing applications. Those are the kinds of things that can start sharing your other information that you don't necessarily want to share if you don't have it set up right. And that's a very dangerous situation to be in, where you turn on the ability to start sharing all kinds of stuff on your mobile device. Okay, use a firewall. Make sure you have all these various security everything you can get for your mobile device. It depends on obviously what the device is, what kind of stuff you can get, but look to see about all these various things you can do to protect your device from the wild and woolly internet and all that stuff that comes in over web connections and email and all this kind of stuff. Keep your software up to date and make sure you know what the apps are before you start downloading them. Make sure you know where they're coming from, who's creating them. Particularly if it's something that looks like it can be useful for you to use with health information that's identifiable, make sure you know where it's coming from and that it's from a reputable provider before you go ahead and start putting any patient information in there. Otherwise, you could be giving away the candy store and all the candy in it just by using something. Hey, this is a nice app. I think we'll use this. Well, you really shouldn't have done that. Okay, because after all, if you start to hand anybody your PHI to manage it for you, that becomes a business associate relationship anyway. So you have to research all these apps and things like that. Maintain physical control of your devices. Use secure connections when you're using public networks. Don't use the general unsecure connections. Basic rule of thumb there is don't use any wireless networks that you don't have to use a password for. That's not the same thing as reusing the password you used last time, but if you go to some place you've never been before and they say, oh yeah, use our free wireless network. No, you don't need a password. Don't use that network. That's a bad idea because it's not secure. Anything where you don't have to enter the password ever is not secure. If you have to enter the password at least once to get access, that gives it the ability to have a secure wireless network. But otherwise, it's not. And anything you send or receive could be easily discovered. Bad guys could easily take control of your computer. I've seen plenty of demonstrations of this. And delete any PHI before disposal or reuse of a device. So you need to think in terms of you, your organization, and your mobile device. So a bunch of questions you can ask yourself are, do you have a mobile device use policy? Do you allow people to use their own devices? And actually, do you know who your privacy and security officer are? So if there's any questions, you know who to go to. Do people have to register their mobile devices with you? And do you have something like a VPN for communications? Or how do you handle people who want to store information on their devices? Do you have a policy on that? Do you have a way to actually have information remotely? Or do you require staff to back up any PHI on mobile devices? Do you require your staff to have remote wiping and remote disabling turned on? You better make sure you do. And better make sure that you provide some mobile device privacy and security awareness and training, too. I mean, these are very sensitive devices that have fantastic capabilities, and you need to make sure you provide the proper training so that people don't misuse these things and unintentionally expose information that they should keep properly controlled. Now, 5 steps to manage mobile devices. They also include a nice kind of tidy set of questions, a tidy set of statements about what you should do. The 5 steps to manage these mobile devices is first of all it really comes down decide, assess, identify, develop, document, and implement, and train. Okay, so the first thing is decide what you're going to do. Okay, decide how you're going to handle these things. Decide how you're going to manage the access, how you're going to manage security. Okay, figure that out. Assess how what you're doing affects your risks. And look for issues that you can control. Look for risk issues that you can identify and knock down, and so you can identify your risk management strategy. Okay, the idea is to understand what safeguards you're putting in place to deal with all the various issues that you've identified, and then put in place the various policies and procedures you need to actually protect the information, get those all developed, documented, and properly implemented, including all the proper training. Step 5, everybody has to have the proper training in privacy and security awareness and how to handle these portable devices. What are the issues? What can go wrong? What are the typical things that happen? And how can you prevent them to protect yourself and protect the information on these devices? And keep in mind, these devices can quite often be an attractor for a crime element that would like to steal the devices. So you always have to be very careful about those kinds of things. When it comes to mobile devices and texting and email and risk analysis, the idea is, you have to look at electronic information. You have to do your risk analysis. That's the core of the security rule compliance, okay, as we were talking about before. So you have to do your risk analysis. You have to think about, okay, what information are we talking about? What information is involved? Is it all PHI or some of it PHI? And what access is possible? Is it just the device we're talking about, or is there access for other systems as well that's involved? And where is the information in motion? Is it secure when it's in motion? Is it properly encrypted? Does it use secure channels or secure packaging? How does it actually get from point A to point B in such a way that it is transmitted securely? And when it's at rest somewhere, is it handled securely as well? Whether it's on a server somewhere or on the device itself, is this properly locked down? And when it comes to the device, can this device be actually controlled properly? Can it be turned off? Can it be remotely bricked if necessary to be able to protect any information that might be on the device? What can you do to control the device, to control access to the PHI? This is all these kinds of risk analysis questions you've got as to how you can actually minimize these risks and manage the systems and manage these devices to be able to minimize the risks. And have you really considered these uses for proper patient care? You need to make sure that whatever you're doing with these devices, make sure it's being done in such a way that you're having proper documentation of communications and consideration of requests and all those kinds of things. So based on the likelihood of issues, based on real-world experience, likelihood of issues that we may have for using mobile devices and things like texting and email on these devices, based on what happens, look, these things get lost or stolen all the time. They are the subject of many a breach, So the likelihood, relatively speaking, is a high likelihood in terms of all the things that can go wrong, And we've seen this over and over again. These things keep showing up on the large breach lists, all right? And as far as the impact goes, if you have limited poorly identified PHI, like maybe a text message about a dentist appointment change, just a simple text message, that's not necessarily a breach, not necessarily a high impact, depending on what the information is and how detailed it is and what you're talking about, How sensitive is it? They have to go through the analysis for breach analysis, right? The impact, if you have a high impact, like maybe you have extensive records, like lots of medical records for an HIV patient, that could be a situation if that information gets improperly exposed, that could be a huge impact, all right? So if you're dealing with these portable devices, you're dealing with a high likelihood and potentially a high impact, So potentially your risks are very high to go along with those potentially high impacts, So when it comes to your typical issues for mobile devices, you have things like your BYOD device issues, the fact that you really don't have any control over the device. Even if you have a mobile device management solution, this is still a device that's not in your hands. It belongs to somebody else. It might be shared with somebody else. It might be used by somebody else in the family to play games with or whatever, There can be various threats in the apps that are downloaded. A lot of these threats wind up appearing in apps that people have thought, oh, this is a good app, we'll download this, and then discover later, oh, wait, this was compromised in some way. This can happen, Be very careful about any apps that you download. Make sure that they're done in an appropriate, secure way and they aren't threatening your other information in any way. And, of course, you have the whole issue of loss or theft of these devices. And with the organization's devices, yes, you still have the issues of loss or theft, but you have a little bit more control over these devices because they belong to you. You can actually dictate how things are going to be and have things, nailed down in such a way that that the individual user really has no control over the device other than just to use it and to make sure they don't lose it. So when it comes to various issues for these mobile devices, you want to make sure you think your way through the various issues. Things like do you have the ability to control these things? What information is going to or from them? What data is left on the devices, and what happens when they trade in? And are there things such as access instructions for other systems with PHI on these devices? In other words, if you have a phone that you don't lock and you leave it open and there's a notes file in there that says, here's how you log into the hospital medical record system. Here's your ID and password. You have that device and you have that ID and password and you've got everything you need to log in to the hospital system, okay? So those access instructions may be on there, okay? That could be something that you're not even aware of. And it is very easy to start using something insecure without realizing it. You start to think that everything you do on your cell phone is secure and ironclad. Well, there may be some insecure things you might start doing if you don't realize it, okay? And there are some significant opportunities to improve work processes when it comes to using these mobile devices. There's no question about that. We can work smarter. We can work faster, okay? But you have to make sure that we're careful about what the issues may be when it comes to the risks that go along with those work processes and changing what those processes are, how you handle information, and what might be threats to privacy and security of the information. It does require plenty of user training and plenty of reminders to keep people on their toes as to what some of the problems may be. Now, patients may want to use these devices for all kinds of purposes, such as for managing appointments or, keeping their appointment calendar or, going up to other kinds of things like, there might be more sensitive, such as receiving maybe some test results or something like that. You might get by some kind of a message or via a secure portal or something. Just use the device as a kind of a way to look on that portal or something like that. Or you may go so far as to have people who want to be able to ask healthcare questions of the office. You might want to do that either by using the phone aspect of it or a text message or email or log on to the portal, all kinds of ways when you have one of these devices that people may be reaching out to you to ask them various questions. And they may want you to provide various healthcare information, either by message or portal or app or whatever. And they want to look at their own medical records, and they want to also receive detailed records that have been put together for you, for them by the office, something like that. So there's all kinds of levels of information in terms of quantity and detailed information, in terms of sensitivity of information. And there's all kinds of ways that people may want to communicate. And the idea is people may want to communicate in different ways and have different feelings about security for different ways of communicating in different topics, such that figuring out this matrix of ways of communicating and topics of communicating and individual preferences can be kind of a daunting process to figure out, well, who are they and how do they want to communicate about what topic. It can be, and the more you look at different ways of communicating, the more you complicate the process, and the more you make it difficult to be able to sort things out and make the right decisions when it comes time to communicate with the patients. So when it comes to providers, they may want to communicate using these portable devices as well for accessing and receiving results and test results and handling appointments and things like that, interacting with the hospital, various schedules and activities, and their own personal appointment calendar, as well as dictation using the phone itself or some kind of an app. And the idea is you want to make sure that you have any dictation being done by a remote server somewhere that's not the server that's being provided by Apple. You can have Apple do your dictation for you, but that goes through Cupertino and gets analyzed there. So you need to be using something where you have some privacy and security of the information. Also, you're allowed, people use their own, providers use their own phones for their own personal purposes, just like anybody else. And also things like interacting with patients and things like reminders and things like that. There's all kinds of ways that providers may want to use their mobile technology. It's part of how they stay on the move and stay in touch with the world and keep getting the job done these days is by having mobile devices. And so really what you're boiling down to is, where has the health data gone, or where can it be? It is now musically wandering around the Internet, and there's all kinds of places where you have technology that's outside of your control, and maybe you have some questions as to, who is accessing or providing PHI? What's the authentication question that's going on here? As well as what's the right information to provide? So it's not just the authentication of who are you, but what are you allowed to see? What's the authorization for you, okay? And what kind of access controls are there in place to protect privacy, to make sure that you have only authenticated people having access to the information they're authorized to have access to? And, so what are the access controls, and how secure for the entity is the interaction point? This is a big issue these days. The bad guys have discovered that there's this RDP port on servers that allows people who are communicating to log in through RDP and control their desktops and do all kinds of things. They're basically acting as a remote controller for their own computers back at the office. Well, RDP access needs to be controlled very carefully. You need to make sure you do things like turn off the default password and not allow people to use cheap or easy passwords. And then perhaps having the access, once you get past RDP, requiring that you have a second layer of access beyond that to keep people from getting any farther than they should, and make sure you keep the bad guys out as much as possible by having more layers of authentication along the way. I mean, weak RDP ports is where the bad guys get in and take over your system and lock stuff up and make your life miserable these days. That's one of the ways they get in. Okay, so, and it's kind of funny for me because I've had this item in a slide for years about how, the question is how secure for the entity is the interaction point. Well, these days it is a real problem. It's not just some guy who's experienced with how things might go wrong, guessing at things, but the bad guys have actually started doing this. And so how secure is the information while it's being transmitted or on the device, and how do you manage these devices? And do you do it through centralized controls or policies or whatever? There's so many questions to look at. So there's all kinds of issues. You might have information provided to the wrong individual because you have poor authentication or poor access controls. If you have some kind of a breach because of it. It could be the patient loses their device. It could be it could be exposed information about themselves, or it could be the device is sending information back into the medical record about using some kind of an app. Well, if somebody steals the device, does that change the data going into the app? Okay, does the device not know who's holding it? I don't know the answer to these questions, right? It could be the provider loses control of their device. The provider loses his device. Could be all kinds of data on there. Could be all kinds of access to all kinds of systems. Could be some huge issues if the provider loses control of their device. And, of course, you have all these plain old issues of data traveling through insecure channels that can be accessible and remain on systems anywhere around the world. Once it's wandering through your own servers and things like that, it does make its way over the wild and woolly Internet that covers all kinds of territory that is not necessarily controlled well at all, shall we say. So email and texting are basically inherently insecure. The idea is when it comes to plain email and plain texting, these things are not secured by default, and these things can be retained by anybody around the world. So there are some secure email solutions you can use, but these things generally require that you go to a secure website and come with an ID and password. And I really hate those things, but that's one way to get around that, I suppose. Individual's email can be accessed by a third party if there's a weak or easy-to-guess password, too. So you have to be very careful when you're using email that you don't use a cheap password. And don't use your pet's name if what you post on your Facebook page is a picture of your pet with your pet's name. And what do you think the bad guy is going to look for first, okay? It's the first thing they'll try. But you do have to have secure communications. It's essentially required for professional purposes. All the consumer-grade stuff like Yahoo Mail and Gmail and texting, these are all insecure means of communication. And if you use those things for professional purposes, they might be considered a breach, depending on the circumstances and the content and all this kind of stuff. You have to do the analysis is the big thing when it comes to breach analysis. You actually have to do the analysis. Part of it is that the technologies for securing communications are readily available today, so it's not impossible. It's just that it can be cumbersome to deal with secure email and secure communications. In some cases, not so much for texting. I mean, you can use a different app for texting. Texting is great for short messages. It's great for all kinds of updates and schedule changes if you're running late and things like that. It can be more appropriate than an email or a phone call. It can be a lot quicker to text somebody a message saying, "Hey, I'm running 10 minutes late. Be there as soon as possible." And they say, "All right, great, thank you." You can carry on a quick conversation without even breaking your stride in another conversation. Okay, so you can have these kinds of follow-on things and give people the up-to-date information. And the nice thing about texting, it's not necessarily dependent on voice. Information can be mangled by voice. Also have to be very careful though, because information can be mangled by autocorrect on your texting app too. If you have autocorrect turned on, it can turn all kinds of reasonable words that you're trying to type into gibberish that makes no sense, and be very proud of itself for doing so. And then you look at it and go, "What was I trying to say? I have no idea, because what it says here has nothing to do with anything I was saying." So, but it can be confirming to have information that's texted in. If it's something that's not terribly sensitive, why not, right? That's how a lot of people feel. This is how I communicate for a lot of my information. A lot of stuff that I decide how to do that I communicate using texting could be a whole lot more sensitive than just some of my health information I might be getting, like when is my next dentist appointment, things like that. And of course, a lot of stuff that used to go by pager is now going by text message instead, because everybody's got a phone. And people are tired of carrying around pagers, I think. Now, when it comes to individual access, you want to make sure that you are, thinking in terms of the individuals being able to use their devices to access information. All right. So you have to be prepared to communicate with them. The people have a right to have access for free, and being able to get copies of their information for a reasonable cost-based fee is what the individual rights are. And you have to have a process also in place for managing denials of access. If you deny access for some reason, it has to be for a proper reason. And for some of these reasons, you have to allow them a right to request a review of denial. And so you have to make sure you have the proper process taken care of and implemented in your processes and documentation. People have a right to see everything in the designated record set if that's what they're looking for. It's all kinds of medical and billing records. Exceptions for certain information, such as like if harm may result or you might expose somebody who provided information in confidence. But also there's exceptions for psychotherapy notes. Those are the notes the therapist is taking during the conduct of the session. Once those get written up as progress notes or medical record, then that becomes part of the medical records. But before that happens, when they're just the raw notes themselves, that's psychotherapy notes. The patient doesn't have a right to have access to those. Also, a couple of things that are in place in the rules now is information that is kept electronically. If the individual wants to have a copy of the information that's electronic in an electronic format, you have to be able to provide an electronic format. So if you have it electronically, then the individual has a right to have a copy electronically in some format or other. And also, people can also access their lab results directly from the laboratories as well. It certainly makes it easier for people to have to do regular monitoring of their lab numbers and things like that. They can get those results directly from the laboratories on their apps and things like that. Also, as far as individual access is concerned, there used to be an automatic 30-day extension for off-site data. That's no longer in place anymore. But there's plenty of background information in the 2016 guidance on providing access to PHI. It's worth taking a look. It's really some of the finest guidance that's out there in a long time, and it really goes into a lot of detail of providing access. So if you're in the world of providing access, take a look. It does touch on mobile device issues. There's no question about that. You can't avoid that these days. I'll make sure I didn't skip a page here, did I? Let me make sure. Let's see. Yep, okay. Okay, so what you want to do is you want to steer some patients to your portal is the idea. I mean, as much as possible, you want them to go to the place where things are nice and secure, right? And most new EHR systems are going to give you some kind of a secure portal option, either as part of the EHR or something you can add on, so that patients can access their records in the EHR system and avoid having to bother you for those things. They can see what's in there and see the records themselves. So you want to be able to want to encourage people to use the secure portal as much as possible. Now, keep in mind, though, your EHR may not necessarily reflect all of the information in your designated record set. That there may be some information that's part of what you would consider medical records or billing records that may not be available in the EHR. So make sure you're prepared to provide that information in addition to whatever is inside the EHR as well. So be prepared for somebody says, "I want a copy of all my records." Make sure you know what that means and where that's all coming from, because it may not necessarily all be in the EHR. You may have to go to other sources for the information. You can't just necessarily always say, "Oh, it's always in the EHR." Well, maybe that's the case, but that's not necessarily the case at all, at least industry-wide anyway. So you have to be able to accommodate reasonable requests to communicate by other means. And it needs to be something that you can manage, okay? If somebody says, "I want to communicate using only smoke signals," you say, "Well, that's very nice, but we're really not prepared to do that today, okay? We're not ready to set up our smoke signal communication process and figure out how we're going to encrypt those communications, because they're going to be visible for anybody to read, okay?" So those are the kind of requests you can say, "Listen, we'll consider your request, but we're going to turn it down too, because it's not a reasonable thing to do." It needs to be something that you can document. How are you going to document those smoke signals, right? Okay, so you have to be able to document things. You have to be able to respond to things in a reasonable way. What happens if somebody's trying to do smoke signals in the middle of a hurricane? You're not going to get the message, all right? So you got to be able to respond to these messages. You got to be able to document the communications you've got. You have to be able to handle reasonable communications and not stuff that's unreasonable. Okay. And also be careful when you're setting costs for electronic copies of records, and make sure you don't overstep your boundaries in terms of what you're allowed to charge. Generally, the guidance is, hey, there's not much you can charge for when it comes to electronic copies. Maybe a few bucks for a memory stick or something like that, but you can't be charging these big fees. So what are you allowed to do? You want to do what the patient or the representative wants, okay? You want to be able to meet the HIPAA requirements, accommodate whatever you reasonably can, meet the patient's needs, okay, because they may have lots of reasons to use their mobile devices to communicate with you. For scheduling, prescription renewals, and things like that. Particularly talking about mobile devices, you're talking about people's schedules in many cases, right? They may also want to have some discussion of particular health issues, maybe access medical records. There's some test results, but again, you want to do whatever you can handle properly as far as patient care is concerned, as far as processing and responding to incoming messages and requests for assistance or information, and also what you can handle properly for medical records in terms of keeping track of all the conversations that take place and all the guidance that's given and the descriptions of issues and situations and things like that. So when it comes to HIPAA and communications and security, when you look at the security rule in 164.312e, it says you have to consider encryption of communications. It's an addressable specification, right? It means you have to look at all your communications and say, okay, for this electronic communications here, is this something that I need to have encrypted to protect it? Okay. And for some communications, it might be inside your building and things like that. You may think, it doesn't need to be encrypted. It's properly secured because nobody can get to this little private network. Okay, well, that might be the case. But generally, if you're talking about stuff that goes out over the internet, you realize, well, it probably ought to be encrypted. But the privacy rule gives patients certain rights to communicate in the way that they see fit. It's in 164.522 and 524. So people have the right to say, I want to communicate using this process or that process. And to the extent you reasonably can, you want to make patients happy. Because when you make the patients happy, they don't complain. And happy patients that don't complain are the kinds of patients that will not necessarily put HHS in your lap for you. Okay, so you don't want to have HHS coming to see you unless you need to have them come see you. All right, so make your patients happy, and happy patients will tend not to complain, and that'll keep HHS away. At least for those aspects, anyway. I mean, don't cause trouble for yourself. Do your best to, make people happy. All right, as long as you reasonably can. Well, the idea is you do what you can reasonably accommodate. That's the important thing, though. Don't jump into something that you can't properly handle. Okay. So you have to be able to, provide a variety of means of communication that you understand. Know how you're going to deal with things like what if a patient says, I want to use plain email to communicate with you. How can you handle that, okay? And the idea is you definitely want to provide and encourage using secure solutions for your communications, but you have to be ready to do something other than what your preferences are. And so you have to have policies and processes in place to accommodate those requests and listen to those requests and respond to them and make decisions about those requests. And not just try and ignore them and hope they go away. You have to actually, deal with these things and have a process for these things. So make sure you establish that and have the proper documentation of these things. So that's the kind of things that HHS asks questions about in audits, no less. So when it comes to managing patient communications, first of all, it's a privacy thing. Patients may not appreciate the risks of loss of privacy. They may not realize how scary it is to use something like, plain email or texting, because they may not realize, how much of their information might be collected and exposed on down the line. But you have to try and do your best to meet patient communications preferences, explain the risks. And texting, we're not even sure what the risks are going to be long term. It hasn't been around long enough, right? It's also a medical records thing. Make sure that you have some way to manage your incoming communications and also manage your outgoing communications. Make sure the information that's coming and going, it's possible to have a good paper trail of your conversations and contacts so you know what's happened. Okay, if it's part of patient care, you have to have good documentation. That's just the way it is. It's also a patient safety thing, okay? You have to make sure you triage any incoming messages, make sure you know what people are asking about, and make sure stuff gets routed to the most appropriate individuals. And you can handle things like messages that might come in at, in the middle of the night and things like that. It could be all kinds of information and situations. You have to be able to respond to these things and make sure you're providing appropriate advice. And if your office is closed, say, hey, if it's an emergency, please dial 911. Okay? I mean, you have to make sure you include this kind of stuff, even if it's, not a telephone call, but it's just a text message. You have to be able to respond. You have to establish an overall communications process, and that's what these mobile devices really call for, is a definition of how you're going to use these things for various communications processes, whether they're your devices or the patient's devices, okay? How are you going to interact with these things? Make sure you protect the messages and protect the content so you can provide appropriate services. There's a number of secure texting solutions out there like Telegram, WickerMe, and Signal. Basically, a lot of these have a free version it doesn't use a server. That basically just sets up a channel for two devices to talk to each other in a secure path. All right, they basically set up some way to say, okay, I'm going to send you a secure message. Here it comes. Yep, got it. Okay, and there's none of this, waiting on a server anywhere for anybody to pick it up or anything like that. Now, these are the free versions. Give you something like that. If you upgrade to a version that gives you all kinds of ability to have reporting on conversations and documentation of what's taking place, then they become a business associate to you, and that becomes a paid version of some of these applications. But the free ones that are available are the ones that are, basically used for great. I think they're fine for using with internal business communications. I mean, I think within your offices, you ought to be in the habit of not using the texting that comes built into your phone, because that's the kind of thing that it should be restricted to your to your family and things like that. Okay, and you use a business texting app for your business purposes, and that way you keep your data separate, you keep the interruptions separate, and you can turn off the alerts for your family's text messages that you don't want to be hearing while you're at work, and focus on your work and things like that. There's also other apps that you can move up to that have provide more secure texting for business purposes. Things like Cortex and Tiger Text and Doc Halo and many others. There's lots of these things out there that basically you just look through and get some ideas what kind of possible products there are that you might use for some of these purposes, because these are all the kinds of things that can be helpful to help you find a good secure solution for your communications. And even work your way up to some of the more sophisticated ones, such as PingMD and OMD, that integrate very cleanly and very nicely with the consumer end, and make it easy to, really the whole point is to establish this communications process between patients and their doctors. So you need to have a policy on using insecure communications with patients. Okay, so you need to say something like, well, here's how we how we normally communicate is this, and when it comes to professional communications, this is certainly how we communicate. But when it comes to patients, there are some reasonably possible insecure alternatives that we might consider. So you have to consider what you're reasonably able to do. You want to require the patient to say, I want to use something insecure. It can't be anything you're pushing on them. It has to be something that's requested at their request, and they're showing their preference. Okay. And if they want to do something other than what you're normally planning on using for communications, you can consider it according to 164, 522, and 524 in the guidance. And would this be a reasonable thing to do or not? And if you do something that is insecure, make sure you explain what the risks are and say, hey, listen, you got to be careful if you want to use this. This could be exposing your information. Are you sure you want to use this? If they say yes, then say, okay, well, listen, can you just sign this consent that shows that that shows that you want to use this insecure communications process anyway? And again, it depends on the person. It depends on the content. I mean, let's face it. If I have a skin problem, if I have a skin cancer problem, I don't really care if the communication from my doctor telling me about that comes in a text message or a plain email message or smoke signals or whatever. Okay, that's just me. If I were a high fashion model just making my way through the world, I might be differently concerned about whether I had skin cancer or not. Okay, it might be a big issue for me because it could be a career-threatening situation. All right, so depending on the circumstances, depending on the information, everybody is different. Every situation is different. You have to be very careful. Make sure you get the proper consents in place, and then make sure you get the word out within your organization as to how to communicate with the individual for different kinds of communication. It really is an important thing to make sure that you handle the proper communications. Now, let's see. I think they reported having some problems with the network, but I think things are working right now. So you want to make sure that you also have a portable technology policy. So you have a portable technology policy. Really, the idea is you need to let people know, okay, if you're going to be using these portable devices, you have a responsibility to use them securely. You have to make sure you take care of them physically and technically to make sure these things don't get improperly used or lost or whatever, and make sure they're properly protected in all ways. Protect the devices and any PHI on them, having good passcodes and encryption, making sure that you have the ability to be able to get into these devices using only the appropriate passwords, and making sure the stuff is properly locked down so the bad guys or people who otherwise aren't authorized can't get into these devices. Okay, make sure you have good passcodes and encryption. Make sure you have IT approval for access to these things or for access using these things. Make sure people know that they should be bringing these devices to IT and saying, listen, I would like to be able to use this to access my work email or my work workstation or whatever, or use the app for our EHR system, whatever. Okay. Well, what are the required settings? How do you set this up? You have to make sure this is all decided somewhere that IT will be in charge, and it'll be important to have things like auto wiping and remote wiping of these devices, so you can clear them off and have them taken care of if things get lost or stolen. Okay. You have to make sure your portable technology policy also talks about having good passwords and keeping them secure, and doing your best to keep your personal life and your business world separated. Especially things like photographs, okay? Don't put the same app, don't use the same app for your patient pictures and your vacation pictures. Otherwise, you are bound to show the wrong pictures to somebody, and it's going to be embarrassing for one or more parties to do so. So don't intermingle your personal life and your business life, your healthcare life, because they really deserve to be separate. Use separate apps as much as possible. That's why I like to see people using, here's my personal device, here's my work device. They are two different things, okay? Anyway, remote use of PHI is also subject to controls, making sure people understand that if they're working outside of the office, that they make sure they protect the information. If the device is lost or stolen, make sure they tell somebody, and also make sure they clear the device before they trade it in. If I haven't said that 3 or 4 times already, that certainly is a good thing to say. Make sure you clear it off. So when it comes to these mobile device policies and procedures and bring your own devices, make sure that it's clear about what the technical requirements are, what the policies and procedures are for using these things and sharing them and reporting any kind of incidents. People need to be able to have the requirements of the training and acknowledgement of responsibility, okay? The idea is people need to know, I have to be trained on this. I need to know what the details are of how to take care of these devices, how to protect them. I need to say, yes, I am responsible for these devices. I know how to take care of them. I need to have plenty of renewals of training and updates along the way because these things keep changing. There's always new uses and new wrinkles and new security issues that are discovered all the time. To make sure you have the proper security settings to protect any PHI and use mobile device management tools wherever it's feasible to help automate that process. Define the apps you might use for handling PHI and how are you handling things like email? Are you allowing people to use Outlook Web Access? Does that give you enough security over your email access? Does it give you enough authentication before you have access to whatever's in the email? How much PHI is in your email, and how easily accessible is it? Is it more easily accessible than other information remotely? Okay, you need to look through all these questions when you're looking at your information flows and the sensitivity of your information and your risk analysis. And then things like you can't be jailbreaking the devices holding PHI. You need to make sure that you haven't broken the security on these things. And also make sure people understand that there is a right to remotely wipe these devices, even if they're personally owned, if they're lost. Okay, so if you have a device full of pictures and you lose it, it's going to be wiped. It's going to be wiped automatically, and you're going to cry about losing your pictures. But the idea is to have a good backup of your pictures before the device gets lost, right? As far as security and incident policy, there's plenty of sources for security and incident policies. I happen to like some of these here. The first couple can provide some good resources for your security policies. SANS and also NYU has a great bunch of policies for their student health services. You can look and see what kind of policies are in there. A lot of those are very usable and transferable. I like those as a level of detail and an example of what is a good policy. The lower bullets on this slide have to do with some documentation from the National Institute of Standards and Technology. The second from the bottom is one of my favorites of all time. It's the Computer Security Incident Handling Guide. It is indeed a practical guide to responding to incidents and establishing a computer security incident policy and process. And that's the nice thing about it, is it really helps you understand how to respond to incidents, how to develop your playbook of how to deal with the situation when it comes along. How to develop your policy so you know what's the next step. What do I have to consider here? I have to make sure I'm not leaving something out. Okay, so make sure you take advantage of these tools. They're actually very, very useful things that will help you understand what to do. It always, the more you can have your procedures for how you're going to handle an incident defined and practiced in advance, the better off you're going to be. That's just all there is to it. So make sure you take the time to be able to understand these things and practice them in advance. So when you actually have an incident, you can act quickly and not make mistakes. Now, other information about texting, just to talk about these mobile devices, Joint Commission has had some opinions on these things. First, in 2016, in April, they said, it'll be okay to use secure texting for physician orders as long as you use it the right way, and make sure you have the right security turned on and all this kind of stuff. And then a couple of months later, they said, hold on. We need to have more guidance before we go ahead. What they realize is, listen, if you're going to be doing some texting of physician orders, those things amount to something that generates a charge, so it's got to be properly authenticated so you know it's a justifiable real charge. That's not some kind of a phony charge, okay? So listen, we got to make sure that this is a secure process here that doesn't wind up with some violations of the Medicare conditions of participation. Then they went even farther in December of 2016. They said, we're not going to go ahead with this texting for physician orders because there are lots of complaints about, it'll be a terrible thing. If we have to ask for clarification, what will we do? Well, what do you do right now? I mean, anyway, there's lots of questions that people had, and lots of whining and carrying on. So basically, Joint Commission says no texting for physician orders. Okay, and that's just to talk about the patient care orders is all we're talking about here. Okay, And CMS has gotten into the same opinion. Okay, they've said they've advised their state survey agency directors. Okay, that means the guys who are doing the policing for CMS. Okay, the survey agency directors. They listen. Texting within a care team is permitted only if it's secured. So it's got to be secured if it's within a care team. And it's prohibited for physician orders whether it's secured or not. So we get that reinforced there from CMS saying no texting for physician orders, no patient care orders by text message, whether it's secured or not. And if you do want to use texting within the care team, that's fine, but it's got to be properly encrypted. But of course, neither of these statements have anything to do with the patient communications. HHS Office for Civil Rights says texting with patients should be treated the same way as using plain email with patients. So when it comes to talking with patients, texting is fine just the same way plain email is fine if that's what the patient wants to do. It needs to be their preference, at their expressed preference, okay? You can't push it on them. It has to be their own desire. Also have to consider when you're dealing with these mobile devices, look at the issues of TCPA, the Telephone Consumer Protection Act of 1991. Now think back to 1991. I know a number of you weren't even around back in 1991. But anyway, back in 1991, when you had a cell phone, you paid for every minute, and you paid for every character of every text message. Okay, that's back when cell phones were actually used for telephones. Used to making telephone calls. Remember those things you used a cell phone for? Telephone calls and text messages were a new amazing thing, and you pay by the character for your text messages. And there was a problem with people calling people's cell phones too much and leaving too many messages, especially like bill collectors and things like that. And so part of TCPA was to make it so, listen, let's have some limits on robocalling. So if there's going to be any automated calling, including reminder calls, we need to make sure that we have limits on that stuff so people don't wind up with all this stuff just jamming up their phones and having them cost all their minutes and all their characters and all this kind of stuff. Well, of course, these days that way of looking at things doesn't really work because when you have a data plan for your phone these days, what you do is you're paying for your data, and they just kind of throw in the telephone service and the text messages as a freebie along with all the data you're sending. I mean, that's where they make the money is on the data. Okay, so all this other stuff, the characters and the minutes and stuff like that, that doesn't mean nobody cares about that anymore in cell phones. Okay, this is all basically built to be part of your data plan. So a lot of what's in the TCPA doesn't really count anymore, but the rules are still there. Okay. So if you're calling or leaving a payment-related message, voice or text, you have to have consent, or else there's penalties. You can also leave a healthcare-related message no more than one per minute, or no more than 1 minute, or 160 characters, no more than one per day, or 3 per week. Okay, and you can leave that. You can leave those kind of messages, but you are limited to only just a few of them. And what happens if what happens if you're dealing with somebody who has like 4 appointments that week and you want to send them 4 reminder calls? You're limited to 3 per week. So that kind of messes things up there. And so unless you have consent. So the idea is to have consent before you start contacting people on their cell phones. Now the way this works right now is it's actually not too bad. You have to be very careful, especially for calls or text relating to billing. But you want to get consent up front when you're talking about people's cell phones. And when somebody gives you a phone number these days, what is it? It's going to be a cell phone, right? Okay. So your consent has to be written, but also the situation is a judge has decided that consent can be considered provided if the patient provides a phone number, and the notice of privacy practices is acknowledged as received with a signature, and the notice says that the patient might be contacted for treatment, payment, and healthcare operations using that phone number, then that counts as a consent for being contacted for those purposes because you've signed the notice and you provided a telephone number without limitations, so that basically leaves it so they can contact you for those purposes. Now, there may also be some proposals coming along to change the TCPA rules to allow communications for TPO without consent, but they haven't changed those rules yet. So that could be changing. But anyway, at least you don't have to get consent if you have the notice of privacy practices signed for. Of course, the thing is, they may be asking to change the rules so you don't have to get the signature for the notice of privacy practices, at which point then you'll have to get a signature for TCPA unless they change those rules as well. So it's all tied up together in a big knot of rules and consents and signatures. When it comes to marketing, marketing is making a communication about a product or service that encourages somebody to purchase or use the product or service, right? It doesn't include face-to-face communications. It doesn't include refill reminders unless third-party payments exceed costs. It doesn't include communications about general health care, about, such as the importance of certain tests, or communications about the government or government-sponsored programs. So there's lots of stuff that marketing doesn't include. I mean, I just love the face-to-face exceptions. The doctors are allowed to try and sell you on anything while they got you in the office, okay? There's also communications that wouldn't be considered marketing unless there's financial remuneration for doing so. So unless, if you're making money making some announcements, if you're making announcements for somebody else and they're paying you to do so, then it becomes marketing, okay? But that's stuff like information on treatment, case management, and care coordination, and health-related products or services, or contacts for case management and care coordination. These are all the kinds of things that, so long as nobody's making money on providing this information, then that's the kind of thing that would be exempt from the definition of marketing. But obviously, if you're, if somebody says, hey, make sure I'm going to pay you to tell your patients about various services that I've got, then that becomes marketing, okay, because there's financial remuneration taking place. So be very careful, because when you're reaching out to somebody's mobile device, you could be doing some marketing if you're not careful. So when it comes to communication for healthcare purposes, you don't have to have an authorization. Those are things like reminders and about checkups and refill reminders and things like that. Also, it includes new treatments about something you've been treated for, but also it can include other information about other services and other treatments and other products that aren't related to what you were treated for. In other words, like if I go up to the local hospital for cardiac services, they can market to me kidney services if they wish, because it's not related to what I've been treated for, but it's all the same. It's all the same medical center. Okay. If it's a separate medical center, then that's not. Then they can't necessarily promote the other medical center that provides the other services, unless it is not for unless there's no fee involved. In other words, if it's a free notification about other services, that's fine. But as soon as money changes hands, it becomes a marketing exercise, and you need to make sure you have the proper authorizations in place. When it comes to texting and marketing to patients, if you're doing texting for healthcare operations or treatment option communications, you need to make sure you meet the TCPA requirements, but you don't have to have an authorization unless you have third-party remuneration above costs. But if you are using texting for something that is marketing purposes, you do have to have an authorization as well as meet the TCPA requirements. And when it comes to email marketing and canned spam, you need to make sure that you've thought through all the issues of dealing with email to these portable devices as well, and what you're trying to encourage people to do. Now, what they say is email marketing covers all commercial messages, which the law defines as an electronic mail message, the primary purpose of which is the commercial advertisement or promotion of a commercial product or service. Well, I would think they may follow the definitions of marketing under HIPAA for this kind of commercial advertisement or promotion of a commercial product or service, but make sure that if it is something that would be considered some kind of a commercial advertisement or promotion of a commercial product or service, in other words, something that would qualify as needing some kind of an authorization that would be considered as marketing under HIPAA, make sure that you have the proper the proper consideration of the Canned Spam Act, and make sure you put all the proper things in place to support people's asking not to be emailed for these purposes further. So there's lots of you can head yourself for lots of categories of penalties with violations of communications, but one of which, of course, is canned spam, along with other things like TCPA and HIPAA. So make sure that you don't violate canned spam when you're talking about sending information by email. Some basic rules of canned spam is, first of all, don't use false or misleading header information. Okay, you can't be making stuff up about who you are and what the message is about. It needs to be reasonably accurate. You can't use deceptive subject lines. Okay, you can't have something in there that says, "Oh, this message is about your mother's being ill," or something like that. And when it's not at all, when it's come on for a timeshare or something like that. Okay, you have to identify any messages that are advertisements as advertisements. Let's say this is an advertisement. Okay, and you have to also tell recipients where you're located. I see a lot of junk mail that comes across the transom these days. It doesn't give me an address. You have to have some kind of address as to where you can send something. Where you can deliver some kind of a document or something like that. So you have to tell recipients where you're located. And you have to tell recipients how to opt out of receiving future email from you, how to send you a message that says, please don't email me anymore, how they can go to a website. So there needs to be some simple process where they can say, stop it. And then you have to honor that, okay? You have to honor the opt-out request promptly. And if you hire somebody else to do any emailing for you, you need to make sure that they're actually following the rules themselves too, and making sure that they're not going around the requirements to opt people out when they ask to be opted out and things like that. So there's some basic rules about canned spam. It's sort of good etiquette for emailing anyway. but you want to make sure you don't overlook any of these things when it comes to canned spam. Otherwise, you're going to wind up with some big penalties. Now, when things go wrong and when your communications go awry, then you may wind up with a situation where you have a breach. Okay, and as I mentioned briefly before, a breach under HIPAA is when you have any kind of an acquisition, access, use, or disclosure of PHI in violation of the privacy rule. That covers a lot of stuff, right? I mean, acquisition, access, use, or disclosure in violation of the privacy rule. So pretty much any time you have a privacy rule violation here, you have to stop and go, oh, hold on, privacy rule violation. Do we have is this an acquisition, access, use, or disclosure in violation of the privacy rule? And if it is, you go, well, that sounds like our basic definition of a breach, isn't it? Yes, and then your next question is, do we qualify for any of the internal use exceptions, any of the unintentional or inadvertent things where you just happen to look at the wrong record by mistake, or you happen to have a folder of papers on, the wrong folder of papers on my desk, and I realize they're not for me, I put them on the right desk. Okay, those aren't breaches. These are just unintentional internal uses in good faith or within job scope with no further use. These are all fine things. These are exceptions from the definition of a breach. Okay. Also, an exception is if the information cannot be retained. If you lose a box of records but you get it back and it hasn't been opened. Okay. Nobody got to see what's inside of it, so nobody can retain anything inside of it. The information cannot be retained. That's an exception from the definition of a breach. Okay. It's also you can get to that point there and say, well, if I don't have any exceptions, is this necessarily a breach I have to report? Well, if you don't have any exceptions, but you have that privacy rule violation of that type, and you don't have any exceptions, you do have a breach, but it's only reportable if it's not secured. Okay, so if the information is properly secured, according to HHS guidance, and properly encrypted or destroyed in the process, fully destroyed, fully vaporized, okay, then it's not reportable. Okay, if you don't have that get out of jail free card, your only last out is to look and see, well, do we have a low probability of compromise? The word compromise these days. There's a number of meanings of the word compromise that our friends at NIST, the National Institute of Standards and Technology, they have a compendium of definitions, and they have a number of definitions for the word compromise, and it basically means, in many cases, that if you've lost control of the information and you're not sure what's happened to it, such that there may be a privacy or security violation, then that could constitute a compromise. Okay, so it's a very difficult thing to say something hasn't been compromised, because it could be. It basically boils down to, if you don't know that it's been safe, it's been compromised. If you don't know it's been okay, it's been compromised. If you don't know that it's been locked down and taken care of all this time, it's been compromised. Okay, that's just the way it boils down. Look and see, what is the information? How sensitive is it? Where did it go? Was it actually looked at or not? And has the problem been cured or not? And look at all these various conditions and see, where do we stand? And has the information been compromised, or has it already been released to the wild and everybody knows about it already, and it's out in the open and there's no calling it back? What's the circumstances? Okay, and you can work your way through a number of these questions basically by looking at a table like this can help you think through the process. And the idea is you want to see, do you have a privacy rule violation? Yes or no? Do you have an internal exception? Yes or no? Can it be retained? Yes or no? Was it secured? Yes or no? And do we have a risk assessment showing a low probability of compromise? Yes or no? And you step your way through the process and document your way along, and then when you get to the end, you either report it or you don't, but you document how you got there and where you'll be going in the future about that breach. So when it comes to plain email and texting and breach analysis, again, it's a loss of control or a violation of security policy that may result in exposure, corruption, or a loss of information. So what is the information? How identified is it? How clearly is it health information? Okay, or is it just other information? And what's the context of the information? What do you know about the information? What can you figure out about who it is about, or what kind of meaning does it have based on where the information appeared and where it came from and when and things like that? And what do we know about where plain emails and text messages go and who looks at them? Because there's lots of unknowns. We know a lot of this stuff wanders around the internet, but we don't necessarily have control over this stuff. We don't really know what's happened to it. So there's lots of unknowns in this case. But having proper mitigation through disclaimers can help. I mean, the idea is that's a disclaimer at the end of a message that says, please don't pass this on. You're not going to stop that breach, but you might prevent the next one, okay? That's a mitigation action, to put those disclaimers at the end of your email messages and say, please, if you're not supposed to receive this, please don't read it, or please forget it, please delete it, please don't send it to anybody else. Okay, that's mitigation. Now, as far as breaches are concerned, the hacking impact is way up, but we have the laptops and portable electronic devices are still the leading preventable cause of breaches, so make sure that you consider these portable things that we're carrying around as a time bomb. I mean, if you have to make sure that these things, if these things aren't properly locked down and secured, you're going to have a problem with them. You will have problems. If you don't have these things properly secured, you do have problems with them. That's just what's going to happen. Okay, so make sure these things are properly secured. Malicious insiders are still a problem. We have all kinds of new technologies, but a lot of these new technologies also wind up being star players on your portable devices as well. Things like social media and email and texting really are what portable devices are all about. Small breaches are mostly onesies and twosies, mostly paper handling mistakes, but the large breaches quite often are some kind of electronic issue. No surprise there. And the thing about breaches is they're caused by hackers or loss of PHI or theft of PHI. I mean, there's bad guys getting in, or there's stuff that's either devices or something that's lost or stolen, stuff that's left out in the open, whatever. You may have malicious insiders or user errors, people who are working for you who are good or who are evil, and who access information inappropriately or make a mistake or want to sell information, whatever. The idea is if you have good processes, in other words, good technologies that encourage the good decision-making that's required for protecting information, good processes, good security methods, like good technologies that help lock down data when it's being transported or when it's not being used, and good people who are good at heart and want to do the right thing and have been properly trained how to do the right thing and care to do so in a careful way and not make mistakes, okay? If you have good processes, good security methods, and good people who know how to do the right thing carefully, you can avoid the vast majority of the breaches that happen out there today. Because your people are your front line for security compliance. That's all there is to it. And, of course, if you don't do a good job, you can wind up with breaches that lead to these enforcement penalties that can be in the millions of dollars, which is just no fun at all. As far as the enforcement penalties are concerned, there's quite a structure to them. They start with, reasonable diligence starts at $100, reasonable cause starts at $1,000. Willful neglect, in other words, if you have conscious intentional failure or reckless indifference to the obligation to comply. Oh, HIPAA, SHIPAA. I just love that phrase. So anyway, if you have willful neglect, that starts at $10,000, goes up to $50,000 very quickly, and they can levy these penalties on a daily basis as well if there's something that is a daily basis kind of a thing. If you don't answer their questions quickly enough, they can get very cranky with you. It can get very expensive. You might review some of the enforcement pages and see what people have been penalized for. You'll see a lot of these things have to do with portable devices that haven't been properly secured. So make sure yours are. HIPAA audits also have happened in the past. There was a second round that was done in 2013, as well as a first round in 2012. Future audits have been canceled. They're not doing any further ones for the time being. But what they discovered in 2012, which is pretty interesting, is that small healthcare providers tend to have security issues. If you look at the numbers here, based on what percentage of the sample and what percentage of the deficiencies for small covered entities and healthcare providers and security, it looks like small healthcare providers have security problems. I think it's a fair guess of a statement to make. Security issues being like not watching what your users are doing, not being ready for various disasters, not being sure about who's logging in, making sure that you also get rid of your old devices carefully with media reuse and destruction policies, making sure you do your risk assessment, and also making sure that you grant and modify user access in a controlled way. These are all various security issues that haven't been handled properly by a lot of organizations. Look at the privacy issues. Review process for denials of patient access, failure to provide appropriate patient access. Talking about personal access, individual access, and patients. They're using their portable devices for this kind of stuff. So be prepared to provide people the access they're looking for on their mobile devices, because this is a big issue. You can see all the way back in 2012, and a continuing issue is the whole issue of mobile devices, as well as personal access. Now, as far as the 2016 audit program is concerned, when you talk about what was involved with that, they looked at just a very few areas in the 2016 process. They looked at the privacy rule. They just looked at notice of privacy practices and the right to access information, as well as timeliness and content of breach notification, and security rule, risk management, risk analysis and risk management. There's just a few areas they looked at and focused on these particular areas, but notice, right to access is a key issue in there, and that has to do very clearly with a lot of the electronic communication issues, as well as, looking at risk analysis and risk management. These are also things, obviously, you have to make sure you're doing properly for electronic communications. So what's important for your various systems and risk analysis and things like that? Well, when it comes to mobile devices, make sure you're doing all the stuff you're supposed to, all your risk analysis and your all your various consideration of privacy rights and things like that. So when it comes to enforcement and communications, there's almost too many laptop and portable device and lack of security process settlements to count. These things have been going on for a long time. Plenty of situations where people have been using insecure email and using insecure communication devices and things like that and not correcting the issues. Texting has been recognized as an underreported breach issue, so be prepared for that to be increasing as the technology is understood better and how people are using it is understood better, and the fact that there's plenty of communications taking place that may be considered breaches by a proper analysis. And if you ignore texting in your risk analysis, that might be seen as willful negligence, because willfully ignoring a consideration like texting it could be seen as just foolish. All right, so you want to make sure you don't go down that path. Make sure you don't wind up with the willful negligence situations. That you can also help prepare yourself by looking at kinds of questions that have been asked in the past. These are all links that will take you to a number of questionnaires that are all very valuable. I particularly like the second bullet point that's just 2 pages. And the bottom one takes us to HIPAA Audit Protocol, which has been updated for 2018 with a couple of changes. They made, I believe, 13 changes in 13 cells. It's a great audit protocol. The problem is it's not very easy to use in the web page that it's in. It requires taking it out of the web page and building it into a spreadsheet where you can actually look at the questions and answer them and provide more background information and give yourself the ability to use it as a compliance management tool. But there's lots of questions in there. It's a great tool, but in the web page that it's in, it's almost completely unusable, which is a real shame. You got to get it out of there. It takes some time, but once you do, it's well worth it. So your to-do list is don't be in denial, because willful neglect costs more than compliance. That's the first thing. Find out what people are doing already, okay? Find out what people are already using their communications devices for, these mobile devices, and think about the various communications. Look at your professional communications and patient communications as 2 different kinds of communications, and look at your various processes for various methods and communications, and for both with patients and professionals, and make sure you have the proper ways of doing these things properly documented so you know what the right way to do things is, and also specify some of the things that you shouldn't be doing, like certain insecure communications. Secure all your professional communications with a PHI, offer secure patient communications, and develop and document how you're going to be using something that's insecure with the patients if that's what they want to. Make sure you have that process laid down and understood. And then conduct some drills in audit and breach response. Pretend having something go wrong and see how well you deal with it. And then make some corrections based on the results. Always have a plan ready for moving forward, and be prepared to follow that plan so that you can find your issues and plan to knock them down and improve your security stance going forward as you move forward in time